Hi, my name is Sandra Hill Williams, and I'm going to do a prospective dissertation defense practice. And my research involves influence of aquatic therapy in children and youth with cerebral palsy, a qualitative case study in special education school. And this is very dear to my heart because I'm a special education teacher, and also I do have a brother who has cerebral palsy. So this was very important research that I thought was worth doing. And let's go to our next slide. Introduction. Since cerebral palsy results in the progressive loss of motor function with a negative impact on daily activities and participation, despite the well-described benefits of aquatic therapy in children, little is known about the effects of the same in a school setting. Therefore, this study aim is to describe the experience of children and youth with cerebral palsy participating in an aquatic therapy program within a special education school, considering their educational and therapeutic perspectives. A qualitative descriptive case study with embedded units was developed comprising 27 participants. This study employed purposeful sampling to include children and youth with cerebral palsy from Association Agudo a la Paralysis Cerebral, better known as APACE, Special Education School, together along with their parents, education teachers, and healthcare professionals. Also, we'd like to talk about the different types of disabilities. The blue represents slightly spasticity, the yellow represents moderate, the orange represents severe, and the black represents severe impairments. Children and youth who have cerebral palsy who undergo rehabilitation in specialized schools may respond differently to structured exercise programs, particularly with regard to psychosocial outcomes such as mental health and academics and social developments. In other words, sometimes they have hard times adjusting within their academics and their social skills. Therefore, the inclusion of aquatherapy programs in schools may be beneficial as an aquatic exercise and can provide a fun and motivating form of physical activity, supporting the physical, social, and emotional well-being of children and youth. In addition, water exercises are also the most common physical activity modality that is chosen by children who suffer from cerebral palsy, often representing their first choice in therapy. So the research hypothesis dealt with children and youth who undergo rehabilitation in specialized schools may respond differently to structured exercise programs, particularly with regard to the psychosocial outcomes such as mental health and academic and social development. The inclusion of aquatherapy programs in schools may be beneficial as an aquatic exercise and can provide a fun and motivating form of physical activity supporting the physical, social, and emotional well-being of children and youth with cerebral palsy. This study attempts to research how to operationalize and include aquatherapy categories in school settings. The aim of this study was to describe the experiences of children with cerebral palsy participating in a therapeutic aquatic program within a specialized school, as well as the views of their parents, along with the education and the therapy professionals. So the research method was qualitative. Qualitative studies were used. The beliefs, values, and motivations that underlie individual health of the parents, children, and youth with CP, and to identify the relevant intervention categories, as well as issues regarding their experiences of evidence-based assessment practices and the participation in a community-based physical activity are the barriers and facilities for physical activities in special education. So the researcher used observations, informal conversations, and interviews with the participants. The informal and unplanned and unprepared conversations arose during the work week with interactions in the field of study environment and this allowed them to discuss and deepen their knowledge or to ask relevant questions about events. The interviewer approached the participants and asked them about the possibility of inquiring about their perspectives on aquatic therapy by conducting an informal interview with those who agreed to participate. This information was different from information collected using other data tools, observation interviews, and focus groups. Quality criteria number 1, thematic analysis processes. Quality criteria. This gave the guidelines for conducting qualitative studies established by the consolidated criteria for reporting qualitative research. And they also used the Descartes model, which was also followed. The criteria for guaranteeing trustworthiness by Guba and Lincoln were applied. These techniques performed and the application procedure used to control trustworthiness are described in Table 3. A thematic and inductive analysis was conducted by 3 researchers. This type of analysis consistent with the design and covering the multiple perspectives of the case study participants. For example, full verbatim transcripts were created for each of the semi-structured interviews, focus groups, informal interviews, and researchers, as well as field notes. Thematic analysis consisted of identifying the most descriptive content to obtain codes and then reduce and identify the most common categories in categories. In this manner, clusters of codes, in other words, categories were formed, similar points or contents that allowed the emergence of themes describing the experience of the study participants to identify the relevant content researchers read and reread the text, adding marginal notes and forming initial codes. The sample population was chosen, and the socio-demographic data participants included 14, 5 women, mean age years, 10.90 sample population plus a minus 3.77. Those who had 5.9 years of school attendance, number of years receiving aquatic therapy ranged from 4.45, and the GMFCS was 28.5% and 14.2% for the third category, and the fourth category was 14.2%, and the variable 42.8%. Parents, participants, 7 women, 1 man. The average age was 46. Healthcare professional participants, there were 3 women. Average age or mean age was 39. Years of experience in the field was 12 years. Education professionals, participants, 2 women, mean age 36.5, years of experience in the field 14.5. So those were the sample population that was selected to participate in the study. The methodology was used, as we spoke on earlier, was qualitative studies, which are useful for understanding the beliefs, values, and motivations that underlie individual health behaviors. Furthermore, qualitative studies have been used to research the experience of their parents, the youth, and the children with